Hello everyone. Triceps brachii muscle. It is a large extensor muscle of arm located in the posterior compartment. It's the only muscle of posterior compartment of arm. Its name comes from three heads of origin: long, lateral and medial. It's the chief extensor of elbow joint, plays an important role in pushing activities of the upper limb. Origin. The long head arises from the infraglenoid tubercle of the scapula. The long head is an important landmark in dividing the intermuscular spaces. Next, we have the lateral head. It arises from the posterior aspect of humerus, lateral to intermuscular septum, above the spiral groove. Then we have the medial head, which originates from the posterior aspect of humerus below the spiral groove. All three heads originates and joins together to form the common tendon of triceps brachii muscle, which gets inserted into the posterior surface of olecranon process of ulna. Now we comes to the nerve supply, which is the radial nerve, root value C5 to T1, which passes along with the spiral groove and supplies all the three heads of the triceps muscle. Then along with that, the arterial supply is the profunda brachii artery, which is a branch of brachial artery. The profunda brachii artery and the radial nerve are the components of lower triangular spaces. Coming to the action, extension of the elbow joint is the main action of this muscle. It's a powerful extensor, especially the medial head. Coming to the clinical aspects, first one is the nerve injury. Radial nerve injury in the axilla causes Saturday night palsy, which causes the paralysis of triceps muscle, loss of extension at the elbow joint. If the injury occurs at the spiral groove, triceps usually gets spared because the nerve branches to the long and lateral head arises proximally above the spiral groove. Only weakness may be seen due to the medial head involvement because the nerve supply to the medial head arises below the spiral groove. Testing of triceps. Patient's arm flexed at the elbow and supported. Examiner resists extension while palpating the contraction of the triceps. Triceps reflex. Tap on the tendon just above the olecranon. Extension at the elbow can be seen. It is used clinically to test the integrity of the triceps muscle and its nerves. Then we have the sports injuries. Triceps can be strained during athletic performances like throwing, pushing, etc. Surgical relevance. Posterior approach to humerus in fracture fixation requires identification of triceps and radial nerve in the spiral groove. This specimen is dissected and mounted by Aditya Abhilash, Abhishek Raju and Srihar Shambabu from 2021 and 2022 batch. Thank you.